Recording.
Hey everybody, this is Austin Rose. I'm here in my office in Chapel Hill, and I just want to give you a little demonstration of our augmented reality system using the HoloLens for image guidance in the operating room. Okay, and I'll give you a little tour over here now of our physical model. Before I do that, I want to point out one thing in our virtual environment, and that's just a CT scan that we've located over here. It just gives a demonstration of the kind of information you can arrange in the virtual environment that might help you, whether it's imaging like a CT or MRI, or maybe access to medical records, or even a video consultation if needed. So let's work our way back over to the physical model of the head and neck. As you can see, there's a number of fiducials around the model. We're actually only using 5 of them in the registration process, but obviously they help to synchronize the virtual and physical models. I'm going to remove this flap here just to show you some of the internal structures. We have an airway, a thyroid gland, 2 thyroid tumors, a small one and a large one on the left lobe of the thyroid there. The carotid arteries are represented, and it's hard to see, but there is a structure representing the recurrent laryngeal nerve on each side as well. So I'm going to place this little flap back. Now the HoloLens lets us use voice commands, which obviously would be quite helpful in the operating room. So we'll go ahead and turn our model on. All on. And then there you can see the structures virtually that we just saw anatomically. And it's a 3-dimensional representation in this, I guess you'd say, augmented reality. And so there's an overlay of imagery on top of our physical model. We can play with the brightness of that, which can come in handy during surgery, but I'll turn it up there for a sec. One of the things HoloLens lets us do is turn these structures on and off, sort of toggle them as individual components, which is handy as well. All off. Artery on. Nerve on. And I'll remove this little cover now so we can sort of see how things superimpose here. And we'll turn down the brightness a little bit. That can be a useful thing just if you're trying to superimpose an image on top of an actual physical structure. Tumor on. Thyroid on. And we'll pause there for just a sec. One of the things I do want to point out is that the camera on the HoloLens that's in my forehead area is what's capturing this, and so it doesn't line up exactly as the images I'm seeing through the lenses. So that's important to remember, although during our project we were able to demonstrate about 1 to 3 millimeters of accuracy. Airway on. Airway on. And so now we have all of our virtual model represented there. I'll do one last little bit of toggling of the dimming, sort of up and down. But I think this gives you a pretty good idea of what we've been working on and some of the potential applications for augmented reality in the operating room, whether it's localizing pathology, tumors, lesions of various sorts, or helping to protect normal anatomic structures. I think it's only going to improve, of course, and we will see it in the operating room as the platforms like the HoloLens improve, and also our accuracy improves as well. Thanks, everybody. Hey, Cortana, stop recording.